This is the poster Dashing to Performance, a Method for Improvement for RHI Care Week 2022. This was presented at the National Association of Rehabilitation Nursing Conference in November of 2021. The presenters were myself, Cynthia Smith, the manager of Unit 3 and 4, and Troy Carter, who was our Cerner Super Liaison at the time here at RHI. The need or significance related to this project is related to accreditation standards of healthcare regulatory agencies. 100% compliance is expected for Joint Commission patient safety events. Restraint use is one of those patient safety goals that was implemented because of sentinel events evolving around restraint use by the Joint Commission. The learner will be able to describe the use of a dashboard as a visual quality improvement tool, list 5 facilitators of accountability, and discuss the interplay between expectation, measurement, feedback, and performance consequences. At a 2019 regulatory survey at RHI, we had a significant deficiency identified in our restraint documentation and were required to make remediation. The Cerner electronic medical record system had adequate restraint documentation fields, but we were not finding documentation there. Auditing began for the type of restraint, monitoring or temporary release, release reason, patient evaluation status, vital signs every 4 hours, and offering activities of daily living every 2 hours. These are the expected documentation requirements by the regulatory agency. The 2 areas we had the most difficulty with were vital signs and activities of daily living. We tried 2 early facilitators. One was a restraint documentation job aid with electronic medical record screenshots, which were reviewed with staff members by the educator and clinical nurse specialist. Then we provided a documentation quick reference card attached to their rolling computer carts outlining this restraint documentation. One of the primary tools used in lean transformation is the use of visual tools like dashboards to frequently measure performance expectations. The visual tool provides a pictorial view of progress and demonstrates how hardwired the expectations are performed. Accountability for performance is the responsibility to an outcome, not just completing the task. So fostering accountability requires clear expectations, clear measurement, clear consequences, clear capability, and clear feedback. Here's an example of what our dashboard looked like. And Troy, our super user liaison, is the person that kept this dashboard current. And he would provide then this visual tool on our communication boards on each of the units so staff could see how well they were doing. The outcomes originally, the targets were set for 100%. When we did our baseline audit after the visit from our State Board of Health, we were only at 25% performance rate. Obviously, we needed to improve in this area. So with the early education and the tools that we used, we were able to get performance up to 50%. And then eventually over the next year, scores plateaued in the low 70s to mid 80s. So in 2021, we decided we wanted to get this in front of the staff and really increase the accountability for performance. So the visual dashboard was created. It gave immediate feedback to the staff via the visual tool, but also via their clinical manager. And finally, our overall compliance rate for all patients in restraint was consistently above 90%. Here's a graph showing the progress of our improvement over time from when we started in 2019 to where we got to 97% in 2021. The immediate feedback from the nurse manager was identified as the most significant factor impacting performance by holding staff accountable. Instituting this methodology for other documentation has begun for turning, repositioning, and we are seeing a similar impact in reviewing the documentation around turning and repositioning on the spinal cord unit. So in implementation science models, you want to provide a mean to select, design, implement, evaluate, and sustain change, innovations, or interventions in any healthcare setting. When you're working in a complex social environment like healthcare, this requires the interplay of behavioral factors. So taking responsibility or accountability for what is expected is what's needed to create performance. So we had set clear expectations. We provided clear measurement and immediate feedback and continued feedback with consequences reinforced by the manager. If you have any further questions or would like more information, feel free to contact me, Joellen Rust, at the Clinical Nurse Specialist at RHI, either joe.rust@rhin.com or via my phone, 317-329-2219. Thank you.